Welcome to Fertile Minds. I'm Dr. Rashi Kalra, a fertility specialist at Melbourne IVF. Today I'm going to talk to you about AMH, or anti-mullerian hormone. AMH is a hormone produced by cells in developing follicles on your ovaries. An AMH test is a simple blood test that measures levels of anti-mullerian hormone, which may be an indicator of your ovarian reserve. The level of AMH is directly correlated with age. As people get older, their AMH levels decline. We find that the decline occurs more quickly in people after the age of 37 and can become quite critical after the age of 40. Each age group has a specific range for where your anti-mullerian hormone levels should be. What is normal and what is abnormal. It is common that we find people with an anti-mullerian hormone level on the lower end of the range. This may well still be within the normal range for their age group. However, this can create anxiety and concern for patients. What we do know, though, is that a lower level of AMH does not reduce your chance of having a baby. Women who have a lower ovarian reserve and women who have a high ovarian reserve fall pregnant naturally at the same rate. The reason for this is that both groups will ovulate 1 egg per month, and AMH is not an indicator of a woman's egg quality. What it does mean is that you should consider your fertility sooner rather than later, and it's wise to have a consultation with your GP or fertility specialist to discuss this further. An AMH test gives us some insight into the remaining quantity of eggs or number of fertile years you have, but it cannot tell us much about the quality of those eggs. It's an assessment of this current point in time, and it can be affected by several factors. It's important not to have the test performed while you're on any other form of hormone treatment, such as the combined oral contraceptive pill, which can reduce your levels. Certain medical treatments can lead to a reduction in egg numbers and therefore in AMH levels. And these include conditions such as cancer treatment or ovarian surgery. There are also medical conditions that are associated with a higher AMH level. Polycystic ovarian syndrome is one condition that is typically associated with higher levels of AMH. This is not diagnostic, so having a high AMH level does not necessarily mean that you have polycystic ovarian syndrome. You can ask your GP or fertility specialist for a referral for an AMH test. If your AMH level is indicative of a lower reserve, you may then wish to consider discussing this with a fertility specialist, so we can guide you on the best next steps. Thanks for watching, and for all things fertility, please feel free to subscribe.